So one of the things that you got very briefly out of Hallie's great introduction was that Esther is a woman who wears many, many hats. So just to kind of kick things off, can you let everyone know here today who hasn't come across some of your writings and your work and your investments before what you're currently working on?
Okay, what I'm currently working on is called HICCup, and we'll talk about that at length. But just to set the context for long ago I was a journalist, just like Christina, and then I worked on Wall Street for 5 years. Then I watched as these little toy computer things became business tools, and then so cheap and so mass distributed that they were actually consumer tools. And at the same time, I also watched the privatization of the internet, which was this kind of holy research thing, to something sleazy and commercial with lots of energy. And then through this, I ran a conference for 25 years. I sold that in 2005, became an angel investor, saw lots and lots of video sharing for rich white guys deals. And finally, and if you're offended, that's because you volunteered. If you're a nice white guy who cares about health, I'm not talking about you. So I just got more and more interested in health as, along with education, the ultimate interesting challenge. Many people think that it is a do-good thing. I want to prove that it can be profitable so that it will scale and be invested in. And HICCup is about proving that.
You've also been an angel investor for years. And we were talking about this at breakfast, and you said, probably not a good time to pitch me right now, but you're always on the lookout for hot startups.
Yeah, I've invested a lot. I'm in chronology. Sean's going to be speaking here later today, and Omada Health and many others. I'm on the board of 23andMe. But the best good I can do for most digital health startups now is create a place where they can do pilots that prove impact, not just the ability to sell them, but the ability for people to use them actually to improve their health. And that's what I'm trying to do with HICCup. So I'm more or less taking a breather from investing, and because investing isn't just a transaction that puts money in, which is kind of like sex. Investing is like raising the children, and I'm trying to raise one whopping child.
So tell us a little bit more about that whopping child.
Okay. So HICCup stands for Health Initiative Coordinating Council. It grew out of an idea 5 years ago, something like that. It was going to be an X Prize contest sponsored by WellPoint for the community of 5 communities that would be competing that was most effective at increasing health and reducing costs. For a whole bunch of reasons, this thing never happened, but it was a wonderful idea, perhaps before its time. Now I think its time has come. I was speaking at another conference in May, trying to think what I would be talking about, and suddenly realized I had decided not only that this contest should happen, but in fact that I would make it happen. And having decided that, I had to give it a name. I had to figure out how to make it happen, and I'm in the process of doing that. I've got a potential co-founder. So everything I'm going to talk about is what I'm learning rather than what we have done already. But the idea behind HICCup is a contest that's visible, PR, press, between probably 5 or 6 communities that want to be HICCup communities. We're not doing a clinical trial. We're doing something different. We're doing more like a demonstration that this can work. So we're going to stack the deck. We're not going to go to Newark or Oakland or some large place where there are lots of things going on. We're going to find 5 or 6 small communities that self-select. We're not going to pick them. They need to pick us. So we need to obviously be visible so they can find us. We need to sort of look for them and see if they're interested. But it's not some nice, rich white lady from New York coming in and telling people how to live right. It's a community that wants to be a better place to live, that wants its children to be healthy, that maybe the mayor wants to attract more business. The employers want their employees to be healthy and show up at work instead of being down at the clinic or taking care of their sick children. The people in school would really like the kids to be paying attention instead of fighting because they didn't have a good breakfast. All these people get together and say, yes, we read about this HICCup thing, it sounds good, let's find out more. And then these 5 or 6 communities, HICCup helps to coordinate them, and we help them do what they want to do. We help them figure out which programs to use. We help them figure out, can they negotiate with Shine to get 50,000 free Shines? Can they negotiate with Fitbit to get 50,000 free Fitbits? Can they play one off against the other? We'll see. Should they talk to Sean about a geographic community around irritable bowel syndrome? Which diabetes prevention program should they use, et cetera? So they need to decide what they want. Then we also will help them to raise money. And that comes into, there are 3 real challenges here. One is the communities need to collaborate, and that's harder than you might think. The moment Mayor Bloomberg said, let's not tell people how much soda to drink, but let's just make sure they notice if they drink 48 ounces. Everybody piled on top of them. Getting a community to collaborate is hard. Second is figuring out the flow of money so that if you save money in health care in years out, it goes back into the pocket of whoever it was invested in it up front. I suspect different communities will have different business models. 1 or 2 may just be on grants. 1 or 2, maybe we can get Jeff Bezos to invest in something like this as well as in the Washington Post. Who knows? And one reason I'm talking about this, obviously, is I'd love to hear suggestions of communities or funders. So there's a business model that we help them with, and then we also, what I've discovered over the last, okay, I'm gonna ask the question. So how many of you, did they have yogurt out in the main breakfast? I'm part of the elite. I was at the speaker's breakfast. Anyway, would you have noticed if they had vanilla yogurt instead of plain fat-free yogurt? Would you have noticed? Okay. If they didn't, would you have gone and asked for the plain yogurt? No. Okay. Now,
Esther did.
Yeah.
Going away.
I did, but I'm not normal. And what HICCup is trying to do is to make it easy for normal people to be healthy. The decks are stacked against them because we've evolved to like too much unhealthy food. And it's not going to be magic, but if at least you can give people healthy food as well as unhealthy, not just in the cafeteria at work, which would already be a real miracle, not just in the school lunch, which is another miracle, but even in the stores. Our goal is to prove that that actually can work and make a difference without outlawing sugar and without even taxing it, which might be a good idea other than subsidizing. We just want to prove it can work. We may have to use health points or something. But once that's being proven in a small but normal community, that demonstration is going to make it easier for it to happen in other communities.
So these are, these communities that you mentioned, they are self-selecting. So they come to you. And in that sense, can these communities really be a pilot for the rest of, small towns in America? And you mentioned, over breakfast, another story of, how you'd seen 2 people on a bus and, one lady clearly had very unhealthy habits and kept falling asleep every 5 minutes. And you thought about, getting up and preaching and telling her to eat better and how that would have just utterly fallen flat. And is this kind of, HICCup, this model that you're creating, can this be inspiration to other cities, or is this just the very kind of elite?
I think the fact that it can be done and that it makes a difference makes it much easier to persuade other people. Right now, we sort of know this, but there's a huge shortage of evidence. There's a lot of evidence about if you have a specific diabetes prevention program and you can get people to follow and they do these things and they have maybe a like almost a therapy group around them, you can make a difference. Can you make a difference by changing what happens in the neighborhood? We haven't really proved that yet. And I think once you can show that, it makes it easier to persuade bigger communities to get together around this. It persuades parents to say, we want the same thing for our children, even though we're not living in a 50,000 community separate from any other, even though we're in a suburb or a slum or something. We want that for our kids too. So it's like being a role model.
Have you found that there's an ideal spokesperson within any community, whether it's kind of a very vocal parent or perhaps it's even a kid who's kind of influencing his friends?
Or the mayor of Oklahoma City. So far, as I said, we're just at the beginning. I suspect one reason to do 6 communities, maybe more, if they show up, it's like we're trying to deter people to make sure that they're really committed. But if someone wants to copy us, God bless them. That's what's supposed to happen. We need, I think 6 is a critical number because they are not all going to succeed, much as I would like that to happen. And I suspect there will be different models, different kinds of people. So different funding models, different spokespeople. And I'm not sure exactly a reality TV show, but we're trying to get them press. We're trying to, instead of the football team, have the fuel band team. And be proud.
The fuel band team.
Because the long-term health impact will take a long time. The fuel band team winning over the Fitbit team in the other city, that can happen in 6 months. And so this needs to be staged. We need to keep the enthusiasm there and so forth.
So we're definitely you're looking for partners and ideas and...
Partners, ideas of communities that that might be interested, that kind of thing. And obviously funders.
So this is one of those kind of rare and probably a little bit refreshing ideas that feels like it's not kind of a Silicon Valley kind of focused company and that we're not sort of living in a bubble. You're really, working to help communities all over America who have a very different set of kind of problems than, a lot of the communities here in the Valley. Do you think we need more of this in digital health, or are you kind of excited about this nexus of energy that's happening in this area?
I'm excited about both. I didn't leave my old life behind entirely. It's exciting to see people focusing on something that's more meaningful, but it's important for all of us to remember, not how privileged we are, blah, blah, but just how different we are, how lucky we are, and that it's not so easy for people. So, for example, I took the bus, I took the train to get out to Oak Brook, where I had a meeting. For me, that was fun. That was an adventure. But if I'd been in a pinch, I could have called Uber. And that's not what it's like for most people.
You're going to get a lot more resistance and friction elsewhere.
Yeah, but also simply thinking, so when someone here buys a Fuel Band or a Fitbit or a Shine, they might think, well, that's 20 lattes or something. When someone who doesn't have any money is thinking about getting one, it's this or the rent. It's this or my kids don't eat that much this week. So, it's like it's a crazy decision. You wouldn't do that.
But just back to the idea, I guess, of what's going on here. You've seen these trends a lot longer than I have, but I've been just astonished and amazed by how much excitement there has been around digital health and health IT in the last few years. And it seems like something has shifted. Do you feel that way too?
Yeah, it's it's true. But the challenge, as always, is going to be not simply building an app, but building a company. The big issue here is how you take all the data that's being collected and wire it up at the back end. And everybody knows this. Everybody wants to do the mint.com for all the different devices. No one has emerged yet. And when that one emerges, some of the others will be acquired. The first 3 will be acquired. The next 10 will pivot.
So in this kind of digital health landscape, we do hear, you mentioned there's a lot of apps and fewer companies, and there are kind of areas that are getting much more hype than others. One of my least favorite words is big data. So I'm wondering what are your areas in digital health that you think have just been hyped a little bit too much, and where are still the wide open spaces that are ripe for innovation?
Big data is great. I'm on the board of 23andMe. That is big data, but it's also small data. Small data is the data about you. They really go together. The big data helps you understand what the small data means. So they're complementary and necessary. But simply having a lot of big data doesn't get you very far. You need to do something interesting with it, and then this whole marketplace needs a lot more integration, and it's not that people aren't talking to one another and finally opening up their APIs and getting the point, but there's an awful lot of noise, and that's what makes the market. Lots of people need to try something, and then the few winners emerge and consolidate, and then we go on and we do it again. So the excitement is appropriate and exciting.
So you buy into the hype?
I buy into, it's wonderful to see the energy here. It's again, as I said earlier, the same thing happened when the internet opened up in general. Simply, I could get on Google Maps and find out what the bus was that would get me to where I was going. 10 years ago, I couldn't have found that, and so I wouldn't have called Uber either. I would have taken a really grotty taxi.
So back to this idea of the spaces that are still very wide open, and you mentioned one of them, which is integration. But are there any other areas in digital health that if a company walked up to you and said, "I have this idea," that you would just even if you're not investing, you'd be tempted?
Well, there's an idea I've heard a lot. The challenge is actually making it happen, and it's going to be huge. That is non-invasive blood biomarker management, analysis, whatever. So one of the big things about health is that it's hard to measure. So you can measure your weight, and your weight goes up and down. If you're a woman, once a month, depending how much water, all these things. If you drink a lot, you get dehydrated. So it's not a very good marker, especially in real time. But imagine if you can now monitor your blood sugar conveniently, even if you're not a diabetic. Because even if you're not a diabetic, you can certainly see the impact of your behavior. You can check your cholesterol, all these things. Being able to do that in real time without the medicalization of syringes or punctures and stuff like that, I think is going to make a huge difference for the people who care. But when the people who care do it, that spreads in terms of what is seen as normal, what people know about. My goal is to get stuff like HICCup on, well, maybe not on TV anymore, but on Netflix, in the House of Meds, maybe.
There's probably a lot more people in this room today that don't have a historic background in healthcare, that haven't worked in the system, but maybe are coming at healthcare from an entirely different industry. Maybe it's pure technology. What do you think? You think that's exciting? This role, maybe that an outsider, somebody that's new and excited about health, can sort of play in this industry?
Yeah, certainly that's what I'm doing. I started a little earlier, but I came to health from tech. I went to this event with it was a weird event, but there were 20 speakers and 3 of us in the audience in a in a general interest conference. So you had an emergency room doc, a health insurance executive, a nurse, all these people talking about the healthcare system. This was in 2003. They were all people who'd come into healthcare because they cared, they wanted to do good things for humanity, and the system was making it extremely difficult. They talked at length about misaligned incentives, error rates, everything you all know, and it was tragic. I thought, boy, if this was where I lived, out in Silicon Valley, there would be 3 VCs, there would be someone with a non-invasive blood analyst device, there would be somebody with a cure for cancer, there would be, where are these people? It takes outsiders to come in and say, oh, I can fix this. Then the outsiders need to start learning something and understand the challenges, but it's that outside, the difference between whether we can do this or how we can do it. That's what's beginning to happen here, partly because you have all these crazy, optimistic Silicon Valley people who have never met a problem that they couldn't solve with an app.
I do hear a lot from healthcare entrepreneurs, particularly early stage, that they're in this space and they're finding that they are having a lot of conversations and taking coffee meetings with investors, and investors are saying that they're interested, but often not really committing and not writing that check. And is that people call it a Series A crunch? I think that again that term might be slightly overused, but do you see that problem too? Just not enough angel investors and potentially even VCs who are willing to fund some of these great ideas?
I think the thing to remember is that in the end, investors fund companies, not ideas. And they're looking for not just the magical CEO, but the magical team that can build not simply the first product, but a company that's capable of doing the second and third and so on product. I was at a completely different meeting about the Icon aircraft A5. That's one of my other interests. And it's like hardware in general. It was 2 years late, and it cost more than they had originally planned. The CEO, who's a friend of mine, and I'm an investor, who's called Kirk Hawkins, got up and he said, look, guys, I'm not just building you an airplane. I'm building you a company that will train you to fly my aircraft, that will maintain it for you, that will have a new and better product in 2 years. And that's why I'm going to charge you what it takes me to build this thing and a proper margin so that I can build something sustainable for you. And it's that kind of attitude that investors are looking for. Somebody thinking for the long term, not somebody who says I'm going to be the next Google, but somebody who says I'm going to build a real company, whether we go public or get acquired or just live forever. We're going to be sustainable. We're going to generate more value than you put in. And that's the proposition they're looking to hear.
Well, great. Thank you so much.
Thank you.
Just a pleasure.